Well, good morning, everybody, or afternoon, as the case may be, depending on where you are. My name is Phil Fisher, and I am the director of the Stanford Center on Early Childhood. We are hosting this webinar today, and we're really pleased to have this webinar be the second in a series on early childhood and climate. The particular focus today is on specifics around climate and children's health and mental health. And we are going to be joined by three very esteemed panelists, as well as having an intro video that I'll get to in just a moment. Before we start, I just want to do a little bit of housekeeping and let you know that we are very eager to take questions from people in the audience. And so if you are going to pose a question to our panelists, please put it in the chat. We do not have a separate Q&A box, so it's fine to post comments as well. But if you have a question, please use all caps so that our staff that are managing the question input can make sure that we're flagging those questions and get them to the panelists. So I just wanted to do a quick lead off to really frame the issues that this webinar series and today's panel will be focusing on. And I'll start by just saying that Tuesday afternoon, I was here in the office in Palo Alto, and my phone started to blow up. And no, it wasn't some web thing that had gone viral that I'd posted. What it was my air quality index app, because we were having one of those outbreaks of smoke throughout the Bay Area. And those messages about unsafe air continued into the evening and through the next day and really continue today. This is not new to me. I was living in Oregon before moving to Stanford. In Oregon, we have now officially 5 seasons. We have the regular 4, and then we have smoke season, which begins sometime in the summer and continues into the early fall and creates unhealthy conditions outside for much of that time. So we really think that this is an important and timely issue to be focusing on. As we all know, a lot of the issues that have now kind of come to our awareness have not been just sudden occurrences. They date back a long way. But I want to especially focus on the period of time since the pandemic began. In the spring, early spring of 2020, as the pandemic was just getting underway, our team at the Stanford Center began a project called the RAPID survey. RAPID is a national household survey of parents with young children and has been ongoing monthly. It's a national survey since that time. In addition to collecting information about how families are doing, areas of strength and challenges, in 2022, we devoted some survey space for a number of months to asking questions specifically designed to help us understand how things like extreme weather and other effects of climate change are impacting families with young children, and to what extent families are engaging in activities related to both kind of protecting their children and promoting action and activism around these topics. I want to share a little bit of data from the over 1,000 parents that we heard from in the course of the 2022 survey questions on climate. First of all, 57% of all of the families, this is again across the entire US, said that they'd experienced at least one extreme weather event. And in particular, the highest rates that we noticed were in the South and the West. In addition to that, 78% of all of the participants expressed concerns about climate change, and more than half said that they worry about the safety of the environment around their home and the impact it's having on children in terms of things like air quality, proximity to parks, the amount of shade, et cetera. Not surprisingly, the concerns were significantly higher among families at lower income levels. We also gathered responses to open-ended questions, as we always do on our survey, these ones about climate. And I want to read one quote from a parent to help really frame this particular webinar. This parent said, "It was so hot last summer with limited air conditioning that my child's daycare closed. They were not able to keep the classroom temperature under 82 degrees with the window air conditioner. Licensing requires them to keep the temperature under 82 degrees. And so I sent my own child to stay with a family that had air conditioning because we don't have it in our apartment." Now, where do you think this family might live? Is it the South, the Southwest, or Southern California? No, this is Washington State. And so we're really seeing these effects across the board. I think the data that we've found and that many others are reporting really reveal the concerns that parents with young children have about climate change and how these things are impacting the lives and well-being of their children. What we'll be hearing about today is really about how changing climate poses risks to the healthy development of young children, in particular, things like health, nutrition, learning, and behavior. I do want to note that these are both direct effects that are being observed, as well as effects that are the result of what we're seeing as increased unpredictability in the lives of young children because of these changes, which there is extensive science that shows that kind of unpredictability really can impact children's development, learning, academic achievement, and health. So when we see these kinds of changes, we know that they're not new. We know they've existed in communities for a long time. We also know that they're disproportionately distributed in communities exposed to structural and systemic inequalities based on race, ethnicity, income, and so forth. I also want to note, however, that there are many bright spots in this picture that have to do with empowerment and agency and really self-determination, especially at the level of communities and individuals. And we are really hoping to document, along with our partners at the Frameworks Institute, how cultural mindsets related to things like climate and early childhood are changing in ways that suggest really exciting emerging opportunities in systems, in policies, and programs. So I'm going to close my opening remarks there. Before I introduce the panel, we're going to show a brief video that we recorded from Mark Del Monte, who is the CEO of the American Academy of Pediatrics.
Hello, my name is Mark Del Monte. I'm the CEO of the American Academy of Pediatrics. The AAP is an organization of 67,000 pediatricians, pediatric medical subspecialists, and pediatric surgeons who are dedicated to advancing the health and well-being of all children around the world. For us, climate change is a health topic. It affects children just like any other communicable disease or social determinant of health or medical condition, and has to be addressed in that way. For the American Academy of Pediatrics, climate change is a child health issue that has both direct and indirect effects on the health of children and families in the United States and around the world. What we know is that rising global temperatures cause physical, chemical, ecological changes all around the globe, and this poses a threat to the health of children. They are smaller, they breathe faster, they spend more time outdoors. They are closer to the ground than adults in most of the time. They go through critical periods of rapid development in which all of the environmental hazards that are around them have disproportionate impacts. And so we know that the effects of climate change and environmental hazards have direct impact on the health and well-being, the development and growth, the future potential of children. And so for that reason alone, it is a health issue for kids. The indirect effects, of course, have to do with the world in which children are growing up in. If we think about global migration as growing patterns change around the world, the effect of climate change on availability of fresh water, severe weather events that we experience now routinely in the United States, all of those things have an impact on the lives and future of children because of the environment in which they are growing up. And so for those reasons, both the direct impacts and the indirect impacts, climate change is a top priority for the American Academy of Pediatrics. The real challenge of climate change is that we know what to do in order to make this better for children and for all of us and our future. But we're not doing nearly enough, and we're not doing it fast enough. So I think for the health of children, the Academy of Pediatrics is interested in accelerating all of the efforts that we know are available to mitigate the current effects of climate change in the lives of children and to prevent worsening of those effects in the future. The straightforward interventions are very clear. We have to reduce the amount of greenhouse gases. We have to change our energy approach from fossil fuels to alternative energies. We have to think about how to reduce rapidly the byproducts of fossil fuels. One example of that is in the healthcare sector alone. The healthcare sector is very dependent on single-use plastics, and that dependency just accelerates all of the need for pumping, extracting oil out of the ground. So for us, the recommendations in our policy on climate change have a number of mitigating recommendations that are no surprise. They are very consistent with what the WHO and many others have said are necessary to reduce the bad health effects of climate change. But what we need desperately is a sense of urgency. We need a sense of accelerated intervention so that we can get to work now. We've been saying that climate change is a potential negative effector of the health of children for more than a decade, almost two. And so we have no more time to wait. The urgency is now. And so I think we have to realize that the health impacts of climate change are present, and they will be accelerating and worsening unless we take rapid, intense action today. What excites me at this moment is the awakening energy of young people. Young people get it. There's an energy and an intensity of focus on this in a way that we haven't been able to marshal as people who have been responsible for doing something about this before. They understand that the planet is our responsibility, and then in order to protect the health of themselves and the future generations, that things have to change today. And so it's really thrilling to see the innovative, exciting, novel ideas and approaches that young people are coming up with to create change in local communities, to create change in the country, to create change globally. I think they are untethered to the idea that this is not possible or that this is too hard to change. They're not slowed down by that. And so I welcome the engagement and enthusiasm of young people. I learn from how they think and how they approach these difficult topics. And we have to accept their challenge. We have to accept the challenge of that generation and the generations coming behind them to say, look, you have to fix this. You have to work on this. You have to begin right now. This is no longer a theoretical possibility. This is no longer a scientific debate. This is a moment for transformational change. One of the things that we can do as leaders in the healthcare space is articulate very clearly why this is not just a political issue, why this is not an environmental issue, why this is not just a social justice issue. It is all of those things, but it is also a health issue. And we've got to get our arms around that and take some real steps to make change.
Well, those were really powerful comments, and I'm really grateful to the American Academy of Pediatrics, and in particular to Mark Del Monte for advocacy on this particular issue. We're now going to turn to our first panelist, and I'm going to introduce each panelist one by one and ask them to make some opening remarks. Our first panelist is Lisa Patel. Dr. Lisa Patel, just to give you some background information, if you would turn on your camera, that'd be great. Dr. Patel is a clinical associate professor of pediatrics at Stanford Medicine Children's Health, and she's also the executive director for the Medical Society Consortium on Climate and Health. In chatting this morning, she mentioned that she just gave the plenary at the 0 to 3 National Conference in Minnesota. We can see that these issues of climate and young children are really getting onto many people's radar. So welcome, Dr. Patel. And let me just start off by asking you to share what's known about the research about the impacts of climate change and vulnerabilities across the developmental spectrum on young children's health and mental health.
Sure. First, it was wonderful to see Mark Del Monte give that video. He and I first talked about this 4 years ago. We'd put together a conference on advocating for children together, and we'd had climate change as a topic during that. And I said, Mark, you just wait, the climate activists are coming for you. And 4 years later, it's just so great AAP's always been a leader on this. But climate change has really risen to the top in terms of the issues that we as pediatricians advocate on. So that it's just been a great journey with AAP and with Mark. So in terms of how we think about climate change, I think Mark laid out very nicely why children are vulnerable in terms of physiology, spending time outside more, breathing faster, and then what those are. That is a weeks-long lecture. So I'm just going to boil it down into what I think some important points are. I'm a pediatric hospitalist. And so what I see, for example, I see infants that come in severely dehydrated. They don't have the ability to kick off a blanket, for example, or move to a cooler spot if they're hot. Sometimes I've had parents think that they should be giving their infant water because they're hot, and that causes one form of dehydration. Other times they're overbundled. I worked in the hospital during the heat dome event last Labor Day weekend. And because I work in climate change, and because I know that infants born during a heat wave are at higher risk of mortality in the first week of their life, I knew to ask my families, the point that you made, Phil, about access to air conditioning. I knew to ask them if they had access to air conditioning because I knew that in our area, we don't have the same coverage, and two of the families did not. And so we talked about finding safe places for them to go because there is a higher risk of mortality in that first week of life. As we get kids that are a little bit older, unfortunately, I've cared for a number of toddlers who've been left in hot cars, for example. And in places like California or places that are not adapted to extreme heat, we forget that it's just a few temperatures difference that can really tip that car over into really severe heat and cause heat illness and heat stroke. And then children playing outside. I mean, some of these outdoor play structures or the pavement in Phoenix got so hot that if people fell on them, they caused third-degree burns. So these are some of the things that are really concerning. Athletes as well, if they're outside in hot temperatures, heat exertion, heat stroke. I've taken care of a number of older athletes, not younger kids, but it's a risk for kids that are playing outside as well. So heat is one threat. Another one is wildfire smoke, which you also alluded to. I have a 5-year-old son, and now 4 of the 5 years of his life, he has been breathing in this terrible pollution, which early studies are showing that it is up to maybe 10 times as toxic as regular air pollution. The study looked at is if you took an air quality index of 50, if it was just fossil fuel pollution, and you took that same amount of pollution if it was wildfire smoke, we saw 10 times as many children coming in with respiratory complaints. That shouldn't surprise us because when a wildfire burns, it's burning lots of things that are potentially more toxic to our bodies. And again, that period from 0 to 5, this is a period of very, very rapid lung development and growth. And so breathing in those toxins on a yearly basis, it concerns me. And we know from older adults that kind of exposure places you at higher risk for cardiovascular disease, diabetes, and some forms of cancer as well. And then water access and illness. So what we do see because of climate change, we're seeing more and more events where people actually don't have access to clean drinking water, and we see more diarrheal illness. And then the final thing I want to mention, or 2 things I would say. One, and we'll probably talk about this more, one is toxic stress. Climate change is a health threat multiplier for things like food access and housing security, families getting displaced. And then mental health. We're seeing more and more kids suffer from eco-anxiety. A study of 10,000 children showed that 75% found the future frightening, and about half endorsed climate anxiety to a point that was affecting their daily lives. And so what that means, from the time that a child is born and how they're processing the world around them, I think it's really important rather than to think about the ACEs with the PACEs, right? How can we construct environments to mitigate what they're seeing in the news, and we have the capacity to do that. So those are just a few examples in terms of the direct and indirect effects on a child's health.
Well, thank you, Dr. Patel. Really sobering and important information. And I think, the extent to which the scientific data about this are really coalescing in these different areas that you mentioned is really important to recognize, that it's not just sort of one source of impacts, but that there are multiple that are all kind of coming in. And again, disproportionately affecting certain segments of the population more than others because of demographics and other kinds of inequality related issues. So thank you. And we'll be hearing from you more during the Q&A. Now, Anya Kamenetz will be joining us. So thank you for turning on your camera, Anya. Many of you may know Anya's name. She, for many years, covers education for NPR. And she co-created a podcast called Life Kit Parenting on NPR. Her newest book is specifically about the impact of the pandemic. It's called The Stolen Year: How COVID changed children's lives and where we go now. And she currently is publishing a newsletter called The Golden Hour, which she may refer to specifically on the topics that we're going to be talking about today. So welcome, Anya. It would be great if you could share some about your work and your perspective, specifically about why you've shifted from a role that was more broadly on education to focus specifically on climate and advocacy in the context of young children, and specifically related to your journalism and authorship.
Thank you so much, Phil, and thanks for having me on this panel. I'm learning so much. I can answer that question in a lot of different ways. I think on the simplest level, climate's floating to the top because it's so urgent and so important, and it really contains everything else. And like Bill McKibben and others like to say, it's the only international challenge that has a deadline attached. But on a more personal note, I guess I have to say that there's two ways that I look at this work in the context of the work I've been doing for 20 years. One is about rights, and the other one's about feelings. So on the rights side of things, my work has always been about generational justice. It's always been about making sure that young people and children voices are heard, their interests are understood. I find the generational justice lens to be extremely compelling when we talk about climate. The UN has just affirmed that their Declaration on the Rights of the Child, of which the United States is the only nation that has not ratified it, in fact, includes the right to a livable and healthy environment. And when we think about our children's having a right to a livable and healthy environment, we think about something that's enforceable. We think about something that we're going to fight for with everything that we have legally, through direct action, through policy, and in all of the amazing work that people are doing. On the emotional side of things, the reason I sidestepped away, I'm still writing journalism and still covering this intersection of climate education, climate and children's well-being, but I'm also doing advocacy work, and I'm out of my job at NPR because I needed to be able to talk about how this feels. As Dr. Patel acknowledged, climate change is a mental health issue. It's very much a mental health issue for children. It's very much a mental health issue for parents and caregivers, for people in the perinatal period, and for Gen Zers who are contemplating parenthood. All of us along that spectrum are trying to deal with the existential threat that this poses, and the way that it attacks our communities, the uncertainty that hangs over our lives because of this. And so I need to be in a setting and in a tenor where I can talk very honestly about that. I have a lot of, and also to be able to offer solutions. You know, we can't just tell the bad news. The media has done a very bad job of just telling the bad news, really scaring people witless. And I think it's time to talk about solutions. I think it's time to talk about how we construct hope. And my hope is to be able to do that more and more for parents and in school settings, and to uplift that.
Thank you very much. I think that your comments about sort of the factual side of things and the emotional side of things and how they really come together is really critical. And it's interesting. I mean, journalism needs to be, as does the kind of science that Dr. Patel was talking about, needs to be very objective. And yet it's very difficult to avoid the kind of emotional side of this when that is really very much built into a lot of what we're seeing in terms of the responses that are happening. So I really appreciate that you're sort of reflecting on this, not just from a professional perspective, but from a personal perspective. Thank you very much. And again, please be thinking about comments and questions, and in particular questions that you'd like to ask our panelists, and please put them in the chat. And once we've heard from our final panelist, we will will be getting to those questions. So our last panelist, a really great pleasure to introduce Jammie Albert. Jammie is a longtime colleague. She is currently program manager for early childhood success at the National League of Cities. In addition, she serves as a really key member of the Rapid Surveys National Policy Working Group. One of the main goals of the Rapid Survey has been to really get the word out in policy circles where the information that we're gathering can be disseminated and really have maximum impact. And we have really gained so much from Jammie's input into that working group, as well as the other members of the working group, really about how to curate questions and how to share information in ways that make it most accessible. So Jammie, thank you for all of that work, and welcome to your role as panelist on this webinar.
Thank you, Phil. Excited to be here.
Great. So, yes. So I have a couple of questions for you, and I'll ask them together. First of all, I know that National League of Cities, and you in particular, are supporting communities who are pushing work forward on climate on behalf of young children. And I would just love to get some sense of, as I'm sure our audience would, what we're learning from cities and communities across the country who are working on these issues. And then second, I think the other question is, what do you think overall that communities can and should be doing in this area? That is, like, what are vital next steps that might be taken? And I say this sort of both in the context of the tremendous challenges, but also the fact that in communities and cities, we're really seeing some of the most pronounced positive impact and really sort of sense of that things can get done on these issues.
Absolutely. Thanks, Phil. And I think you hit the nail on the head. I just think we're in a space where people want to know what cities are doing. I think, as Anya said, we're looking for solutions, and climate change is a global issue that's going to take local solutions. Like, we have the opportunity to really do that. And I think one of the things we're seeing is that this work is place-based, and it cannot be done without in concert with the community. We have federal legislation and funding coming directly to cities, and local government is in a space where they can implement these actions as well as spark innovation across the country. I think overall, across the board at NLC, we're seeing cities working to cut energy use more renewables, transform their transportation systems. And through this work, through their local climate action and sustainability plans, we're seeing cities and towns create jobs, adding transportation options, and spurring green energy investments that cut utility bills, provide energy choices, and increase livability for their residents. We talked about everyone wants to live in a healthy place, and city government is responsible for a lot of those things to increase livability. I think we're seeing the recognition of the influence that environmental challenges, both natural and built, have on early childhood outcomes. And I think in our work, we're really working to elevate that and elevate those intersections at a higher level. I think that's one of the key learnings of the role of what city government can do, their role as a convener to bring a variety of stakeholders together, but also as a strong advocate and a trusted voice to get the message out about the importance of this issue. This work is not new to NLC. It's newer in my space, which every time I have a conversation, I'm excited and I learn more every day. And to me, that's just opportunities to help drive action with the cities that we're working with. But there's been long-term efforts from our partners in our Center for Municipal Practices as they assist cities in building their resilience plans, looking at the impacts of climate change. Additionally, we have a body of work that's focused on cities connecting children to nature, which really looks into those nature-based solutions and enhancing the capacity to connect children to the benefits of nature more often, as well as more equitably. And I think that's a key learning, and being able to tap into the resources that are right in your community. But I think one thing that we're learning is the general framing of this, and there needing to be a shift. I think when we talk about early childhood, people automatically go to youth and school-age children. And as Dr. Mark spoke about earlier, it's that urgency of now and the need to go down the pike and begin advocacy and action in the earliest years, and just underscoring that, as well as Anya's point about there's a deadline to this for this work. And we can't wait until children are in school age to begin to improve outcomes outcomes reactively, but we have the opportunity to address these impacts during the earliest stage of life. And one other key thing that I'll recognize, a key learning that has surfaced across all areas of this work within NLC, is the need for cross-sector collaboration for stakeholders whose work connects both climate resilience and young children. There is the dire need to bring these two sectors together and at the decision-making table with the community, because everyone's coming to this work from a specific angle. You either have children with nature's access, there's the school readiness, there's the farm to early childhood, children and environmental health, and outcomes will be stronger if there's more alignment and coordination between these stakeholders. So I think that is one of the key learnings that I would elevate. And to your second question, I just think what cities can do within these climate action plans, we're seeing communities, there's, I don't want to say minimum consideration for early care and education, but it's not often called out. I think there's the mindset that the children are taken care of, it, and it's implied. And I think one thing that we city government leaders need to consider is being intentional about naming early care and education and young children and families. And that, I feel like that's a huge win. And different considerations as they continue to build out those plans are emphasis on the impacts of health. We spoke about extreme heat and the impact that it has on young children. I think drawing those connections between emissions, pollutants, and children's respiratory health, as well as highlighting mold prevention, efforts to protect children, healthy housing initiatives, and a commitment to building sustainable homes for families. I think those are some of the things that cities can begin to consider. And just really quickly, I think if we think about increasing green infrastructure and how that can improve air quality for children, again, I don't think I could speak enough about the importance of coordinating policies and programs across city departments. It's not just, this work can't be done in silos. And we have to be able to do that and help advance. I think that just helps advance a shared vision of what we want to see in communities. And ensuring infrastructure is child sensitive is a thing that cities can do to consider. How are they investing in resilient infrastructure, but keeping young children top of mind? Yeah, so those are some of the things that I would say, just really quickly getting into that.
Thank you, Jammie. That was really helpful. And I think one of the things that I take away from your comments is that there is a lot going on and there is a lot that can be done. And I think that's one of the things that's really critical in this space right now is that, you know, the news and it is so dire and so much of the time. And as we talked about, these effects are noticeable all around us, where regardless of where we live. I was in New York last year in the midst of when the smoke was coming down from the fires in Canada. And I think it was a real wake-up call for a lot of New Yorkers that even these kinds of events that involve these large fires can make their way over the course of many thousands of miles and still be affecting health and well-being. So thank you for that. And really excited now to kind of shift, and we'll bring all of the panelists on for the opportunity for some question and answer. So again, if you're listening and would like to hear some specifics from our panelists, please post those in the chat in caps, and I'll be able to ask them directly to our panelists. My first question, which I think is a really interesting one, and I'd love to hear from all of you on this, is what are some ways that we can teach young children about climate change while avoiding the kind of anxiety or kind of climate doom mindset that it can invoke for them? And I'll just let you kind of figure out who's going to speak first and second and third, but please go ahead.
I can start. I think what I've learned in this journey, and Anya, I really appreciate you sort of talking about this journey of needing a place where we're able to talk about our emotions for this. And so what I've done with my kids and what I talk about in terms of my counseling is that for me, my husband and I are very connected to being outdoors. And so we spend a lot of time outside, and we use that as a point of connection to why this is so important to us, like why mommy's away to do all this. It's to save this. And that's my connection. But I think different people have different connections. So I would say part of this is, you know, you as an educator or you as a parent, what drives you in this world? Is it that you like to be in the water? Is it that you like to grow food? And I would say pick something that is important to you as your way to message that I love this thing, and that's why I'm fighting so hard for it, and use that framing of love and value as I think also a framing of more that is more hopeful than gloom and doom. I'd love to hear the other panelists' thoughts.
I spend a lot of time in conversation with educators and education trainers, and really what's coming up in the school setting is understanding that climate is not a topic, but a lens. It's not a STEM curriculum topic, but it's something that we really try to infuse across the school. And it's it's a fascinating but challenging change, because we're trying to change school infrastructure, right? We're trying to change how schools are powered, what they eat, and similar to what Jammie's doing in cities, and very connected. And then within the school, you're trying to teach climate science, also climate justice, and also climate emotions. So kids are learning civics. They're learning climate change and civics together. And that's essential, because they need to be empowered with paths to make change themselves and be part of the solution. And they also need the social and emotional skills, because anxiety is happening to all of us. Worry about the future is happening to all of us, and we need those social and emotional skills and the fluency to understand that climate emotions are universal. And I believe there's a version of that at home as well. I mean, yes, you talk about the science and what's happening. You also need space to listen to your kids and their emotions, and you need to be able to take positive actions to make a difference, while giving them that sense that, you know what, it's not on me alone to fix this. This is always going to be a group effort, and there are millions of people all over the world who are part of the solution.
No, thank you. And I agree with that, Anya, about the educators. I put on my lens prior to my time at NLC. I was a classroom teacher, and for years I did a summer camp. And I'll never forget, for 2 summers, we did a curriculum around getting to know your city, and just how many children had not even taken public transportation, and just understanding that access, but getting them to see what's happening in their world and take ownership of it. A key piece of that was helping them be good stewards of the earth and understanding what it means to take care of your community. And I think that's a great way to reduce climate anxiety, but kind of shift the narrative to empower them to see that I play a part in this and making this a better place, and just having them understand what it means to take care of the planet, as well as how the planet in turn takes care of us. So I just think shifting that narrative is a great way to get children to understand it and not have anxiety around it.
Those are really, I think, poignant comments from all three of you. I would just add, just to sum up a couple of things. First of all, that your comments all really make clear to me how intersectional this particular issue is. That is to say, you can't really sort of put this in a single container and say, oh, climate change, early childhood, and children's health is just one thing. There are so many different angles and so many different lenses that I think this concept of it's a lens, it's not just a specific topic or a specific curriculum. You can approach it from an environmental justice perspective. You can approach it from a systemic and structural inequalities perspective. You can approach it from a biological impacts of early stress on children's health and development perspective. All of these are kind of coming together. And I actually think one of the challenges for all of us is to develop models to be able to articulate this, to study it, to communicate it, that invoke that full intersectionality. Because if we don't, we really run the risk of sort of missing pieces of the puzzle that are critical. The other thing I just wanted to say quickly about this is that I think that it is possible, very possible, and I've learned this from our friends at the Frameworks Institute, for people to hold opposing mindsets at the same time on particular topics. And so I think there can be a sense of fatalism about all of this. And I think it's understandable. And there can also be a sense of agency, that there are things that can be done. And I would encourage us to recognize that in individuals, in communities, in organizations, both of those things may coexist. And so part of our question is, how do we invoke more agency, even in the context of what can sometimes feel fairly fatalistic? Okay, Jammie, I'm going to turn to you for the next question, which is specifically, it may be something that you refer to one of your partner organizations for, but the question is, what are some initial steps to begin the kind of actions that you're talking about at a county level? This question comes from a participant in Riverside County, California, through their initiative Build Up in Riverside County.
No, that's a great question. I think one thing, I think they can start in the same place that even where city government is starting. And I'm sure my colleagues at the National Association of Counties have a wonderful set of resources. Their prenatal to 3 work is amazing, and they have a ton of toolkits that can help you get started even further, especially as you're making those intersections with young children. But one starting place that I would suggest is really assessing what's available. What are the policies and programs that are currently in place, and then begin to recognize the gaps on what needs to be done. Also hearing what are the needs of the community specifically. I think that's so important, and I don't think we can stress that enough. As we're looking to create a better world for our residents, you have to have their voice at the table as well. But I would definitely suggest that assessing what's in place and honestly looking at what's being funded, besides what's just listed as a policy or a program, but what is general funding dollars actually supporting, and how are we advocating for that on that level as well?
Thanks very much, Jammie, for that. Next question to really all of you or whoever would like to respond is, what role should educational and entertainment media companies play in promoting climate solutions that kids and families can themselves kind of act on? And there's recognition that Anya is doing some work on this issue with Aspen, but all of you may wish to comment about this.
Yeah, thanks, Michael, for that question. And I know you know a lot about it from your work at Noggin. So, children, like it or not, they spend, more time often with media than they do at school. And there is a very strong role for educational media and pro-social media to play a role in supplementing what we can give kids at school and at home. And this goes all the way back to Sesame Street and Mr. Rogers' Neighborhood. And so I'm really heartened to see the impacts at Aspen Institute, and then This is Planet Ed. We're starting a climate media for kids vertical, and just encouraging entertainment makers to make space for this conversation, to start the conversation maybe in places where kids don't have access at home. And this is something that it can be a long haul. There's definitely a lot to learn about how we present these topics in a way that is amenable to kids, it's developmentally appropriate. But I think that there's so many kids that I know that have such a love of nature and such a huge curiosity about the world. And we know that video and digital media can be part of satisfying that and piquing that curiosity and helping shape kids into climate leaders in the future. So we're hoping to see a lot more of that.
Others, anything to add?
I think a story that, and I don't think we've even named this out loud, that climate change is caused by fossil fuel burning. And so how do we, because I think too often we talk about climate change like it is a big problem, but the solution is actually quite simple, in that we need to get off fossil fuels. And so what I'd love to see in our narratives and our teaching and how people understand the story of climate change is that we understand that who the bad faith actor has been in all of this, which has been the fossil fuel companies.
Thank you. A related, sorry, Anya, did you have something to add? Okay. I think this is a question just following up on health related issues. So I think it's Lisa, you in particular, but others, again, please chime in. Can you speak about advocacy for pregnant people?
Sure. So, and I didn't get to talk about what climate change's effects is on pregnant individuals, but a lot of the same pregnant individuals are also vulnerable to the effects of heat and wildfire, food insecurity, displacement, mental health. All these things apply for pregnant individuals as well. And so, advocacy for pregnancy. I know, for example, March of Dimes in the Bay Area has taken this topic up as some of the counseling that they're doing for pregnant individuals to help them have access to things like air purifiers, to do counseling on the air quality index, to understand that it's not a good idea to be outside on a smoky day, for example, for the health of the mother or for the developing fetus. And so I think there's a lot of work to be done in this space from the clinician point of view, doulas, people who are working with pregnant individuals to make sure that they understand what the health threats are and that information is reaching this population to be able to take those protective behaviors.
Anything to add, other panelists?
Just a word about the mental health dimensions of this. Climate anxiety can have onset in the perinatal period, and we have so little support for families in this country anyway. Making sure that they're not forgotten when it comes to preparing for climate emergencies and making sure that they feel supported.
Great, thank you. And follow up to you, Anya. You mentioned that you felt that there was a line that couldn't be crossed, but still being at NPR and wanting to be an advocate. And I think the question is sort of what was the line specifically? Did it have to do with objectivity? Is that what you meant? Or were there sort of other issues kind of at hand in that decision?
There's an amazing climate desk at NPR, and there are reporters doing really important work that is pushing the whole conversation forward. It was really for me in my own ability to say the types of things that I wanted to say and tell the stories I wanted to tell, not to mention actually work hand in hand with nonprofits and community-based organizations to push forward initiatives that I felt like I just needed a wider scope. It's nothing against the standards that NPR maintains, which they do for very good reasons.
Thanks. Couple of additional questions, and then I'll have a final question that I'd like to hear from each of you about. This question is that considering the mental health and physical health of Indigenous communities, what are some examples of ways to address climate change mitigation strategies while also acknowledging the impact of things like lithium mining, wind farms, et cetera, on sacred lands? I think this gets somewhat at sort of this question of fossil fuels as a challenge, but that other issues also affecting environment.
It is a wonderful question, and I think we're all silent because it's and so. Right now, for example, there's a new rule on copper smelting that's being considered by the EPA. And I think this is a place where it's very important to be working very closely with environmental justice organizations because we're going to need a lot more copper for the transition, but we shouldn't be polluting communities to be able to do that. So I think as we're thinking about what resources we're going to need to electrify, this is where we all need to be working with communities on our guard, make sure that we're not creating another crisis to address the one that we're trying to address in the present moment. But it is complicated for sure, and it takes a lot of intentional work and outreach and paying attention to what's coming down the pike.
I mean, yeah, as an outside observer to these situations, the politics of this environmental justice is just starting to be recognized in federal policy. And, phrases and words such as no sacrifice zones and land back and Indigenous sovereignty all come into play here. The truth is that the answer comes in a decision-making process where people have agency and people have real choice and real ability to talk about the pros and cons. And there's been so much desecration of trust of Indigenous communities and their sovereignty, and that there's a lot of rebuilding and trust and truth and reconciliation to be done before people can even feel like they have a voice in these conversations. And until they do, it's going to be a series of confrontations. It's going to be very bitter, very ugly. And so, for me, that I've really put my focus on where is the process and how are we including people in the process in a meaningful way.
Thanks. Okay, I have one last question directed specifically to you, Jammie, which is, I think, a really important one. We've talked a little bit about early childhood education programs as sort of one of these intersectional areas. The question is, how can ECE programs be invited to the table and represented in city planning and programming? For example, ECE programs really need to update and prepare environments and need guidance and funding. So what should directors and educators do to start this intersectional climate work and collaboration in the context of things that are happening in city governments and city planning?
Absolutely. Sometimes I think you have to invite yourself to the table. And you can't always wait to be asked, because those ECE programs and providers are the ones doing that work, and you understand the needs. And so I think you have to elevate your voice as well. It is a great opportunity for a key partnership for local government as well, because you all, again, are the one who's doing the work, but so they need the understanding of what's taking place day to day to couple that with the advocacy of policymakers. So I think attending open forums, council meetings, wherever you have the opportunity where your voice can be heard, I think elevate those stories. I think leverage your parents to talk, because you are in childcare providers, children probably spend 80% of their day with a provider more than they do with a parent. So I do think that is a key opportunity for lessons for city government. We think about licensing regulations. How are you talking with the zoning department, and even understanding we keep talking about heat? And honestly, I just learned a few months ago from our partners at Save the Children, and certain cities have regulations for childcare licensing that when the temperature is above a certain point, the childcare center has to close. So even having that understanding and emergency preparedness, how do we get people trained? Like, these things are going to happen, but what do you do in those emergencies? And I think that's a key way that cities and ECE programs can partner and have with the local fire department, where evacuation routes, different things of that nature. So invite yourself to the table, elevate your story, and lay out the needs that need to be done. But I do think it's a great opportunity for partnership to ensure safety for children across the country.
And I would just add to that there are a number of national advocacy organizations that focus on early childhood educators, not just center-based care, but family, friend, and neighbor, and home-based care, licensed and unlicensed. And if you are thinking about how to kind of lift your local voices, the national advocacy organizations and networks are also powerful partners to work with. Great. Okay, so we are running close on time. I have this one last question for each of you to give some quick comments about, which is, what gives you the most hope, even when hope is hard to find?
I'll chime in. Just that conversations like this, that there are people fighting this good fight and advocating on behalf of children who can't for themselves, but even the youth who are elevating their voice. I'm inspired by that. Earlier this week, I was at the CGI meeting, and just Reverend Barber spoke about a moral approach, and that when we're taking moral approaches, we have to center the poor and those who are most impacted. And I just think we're at a phase where that urgency of now, we're centering young children and families and vulnerable, I don't even like to call them vulnerable populations, but promising populations, because those are going to be the ones that take us out of this space and into a better tomorrow. So that I cling to that, and that gives me hope.
I love that. I think it's really that is really the answer. I think for me, when I think about hope, I think about gratitude. I think about the fact that I'm grateful to be in this work. I'm grateful to feel the connections that I feel, even when it's hard to see what we're losing. There's so much more that we want to fight for and that we're here for. And the hope really comes when you make a plan and you act on it and you have energy for the future. That's what hope is. It's the strategy. It's not something that comes to you when you sit back.
Yeah, and I just want to echo, I think what gives me a lot of hope is my inbox is a disaster zone, because I'm just getting more and more emails from people that are concerned and want to play a role and want to play a part. And so I don't think about the number of unanswered emails. I think about the number of people who are concerned and want to play a role. And what I challenge everyone, and Phil, I think you said this very beautifully. And what I try to teach people is that this is only going to work if everybody brings the climate lens to your work. And it can be 5% of what you can do. It could be 100% of what you do. But all of us need to be attaching a climate lens in some way to the work that we do if we're going to solve this crisis.
Thanks so much. I really want to thank our remarkable panelists for both the work that each of you is doing in this area, and for being willing to join us and share your experiences with our audience and with our team. We will be following up to kind of share additional resources on these topics. So if you're in the audience and have thoughts about additional ways that we can continue to kind of build this sense of movement really in this area, please be in touch. We also have just a survey about the webinars, and there should be a link posted in the chat. We'd encourage you to complete that for feedback. And just thanks so much again for everybody who's contributing to this topic. We know that in addition to our guests, there are just remarkable people across this country and internationally, globally, who are really thinking about this issue, who are concerned about the well-being of very young children, understand that the earliest years are the most important for everything that will follow in terms of health, in terms of academic achievement, in terms of well-being, in terms of addressing the numerous inequalities that we know exist. Our center is singularly committed to creating equal opportunities for all children, regardless of circumstances and geography. And so this really is a critical topic for us in which to really shine this light and again, bring that lens to all of the things that we do. So I share our commitment to that with our panelists and with our audience. And again, thank you so much for joining us today. And we look forward to being in touch with you in the future. And thanks again to our panelists.